So our job is to wrap things up and try to provide some context, not only for what we did last night and today, but a path going forward. And what we thought we'd do is share with you some thoughts that Lee and I have recorded, talked about, networked with people over the course of this last day and a half, and then certainly leave it open to you to add your thoughts and comments, and I think more importantly, talk about a way going forward. So let's start with last night. Callum McRae, fantastic, talking to us about One Brave Idea. What did you take away from last night, Lee?
Well, I thought of his desire to become an expert at failure was something that we could all learn from, and the notion that when we're recording data, it's not just data for data's sake, but it's what can be enlightening and discriminating. And I think One Brave Idea, OBI, and the new center here is going to make great strides. I'm looking forward to hearing about it in our next session.
And along those lines of the themes of the information, and that was something that kept coming up over and over. Nancy talked about that today. You'll also note that while Lee took notes, I just took other people's thoughts from Twitter. So here we are today. I thought two of the really important things. How do we get access to the data, and how do we actually use that data and technology to improve healthcare? Not just technology for technology's sake, but how do we actually improve healthcare? And then a key theme, in fact, one of the loudest applauses during the day, I think it was from Laura, when trying to sneak behavioral health into the medical student and resident curriculum. Important themes that we need to be thinking about. Lee?
Well, and from Dr. Peterson's keynote this morning, you know, it's not just enough to have a solution. It has to be pragmatic, scalable, and evidence-based. And I think that's a lesson for a lot of us here.
Yeah, the whole emphasis on science kept coming up throughout, and we need to formally test things, not just assume that they're going to work. Here were some key ones, and in terms of sucking the joy out of our lives, the EHR. And despite earlier...
Now wait a minute. 15 years in bringing EHRs out, so I've got to be a little bit careful with regard to what we say there.
EHR, where the data goes to die. We brought data to life at the point of care. So there is an issue for clinicians with the EHR. We love it and we hate it. We love the fact that we can access all the information at the point of care with our patients. We hate the fact that we're scribes and data technicians. And so some of the exciting things we heard about, including the use of Alexa, Google Home, voice recognition, machine learning to create notes, billing codes, et cetera, that's fantastic. That would bring joy to the workforce.
Well, there's no question that some of these technologies are foundational. You have to be able to collect basic clinical data in order to be able to do something meaningful for a patient. But when you think about patients, they're more than just patients, as was said, I think in Dennis's comments this morning. They're people. We're consumers of healthcare. We're not patient anymore. We want to be more active in our care. And so what else do we need to know about someone in order to be able to take better care of them? And I think this is about building the right collaboration between provider and consumer in order to make that happen.
Yeah, I thought Dennis said it beautifully. It was one of the phrases that stuck with me, people, not patients. And it certainly fits into one of the second comments here about health inequities and health disparities. And one of the key themes of the AHA is meeting people where they live. And so how do we make sure that we're not using technology to benefit a few, but to benefit all?
The other point here in terms of looking at David Vincent's comments and what's happening with Exertia, and two things that he had said. One, about the current Appageddon that we're all faced with, 300,000 some odd apps that are out there, and yet so few of them used and making a difference. But the other comment that he started with that goes back to this notion of personalization is, what does ME stand for? ME, my experience. Yeah. And I think it's about understanding how do we all experience care that's going to make a difference.
Then another big theme that came up is that you've started to build upon, which is how do we evaluate all these applications? And you called it Appageddon from David's talk earlier this morning. And then Jim Malt was just a series of one-liners after another with his, digits, not widgets. This is the one that I liked. If there's no Buck, there's no Buck Rogers. I put that out on Twitter, and a bunch of people started answering me as to what movie it was from, which showed they were paying attention. What did you think about the whole aligning economics with value of outcomes?
Well, I think that we heard consistently throughout the conversations today that it's more than just the tech and the specs, I think was another comment that was made. It is about the consumer experience. And I think it was Terry who started to talk about that experience will drive demand. There'll be pull-through of these types of solutions in the market. You know, some of these, when we talk about viral in terms of other consumer services, that doesn't mean a disease that we have to inoculate against. Viral is a good thing. We need viral adoption of some of these solutions in order to make a difference in care.
And then in the afternoon, we moved into, I think, some really interesting topics. We talked about virtual reality, talked about artificial intelligence. We talked about the changing of our cities in artificial intelligence. As a clinician, another great line from Mintu Tarakia is he thinks of AI like fellows, that they're there to actually help you. And those of us that work with fellows, we say that with all niceties attached to it. What do you think about the AI session?
And from that panel as well, what I liked was the saying, the reward has to be worth the risk.
Yeah.
And certainly introducing innovation for innovation's sake. And there's been a lot of talk recently coming out of places where there are leading technologists who are warning about some of the dangers of AI. We saw a little bit of it in terms of some of the bots that were used in amplifying some of the fake news, so to speak, in the last election. We have to be careful that AI doesn't become something that supplants good judgment. When we talk about it in our shop, we say, we're not so much looking for artificial intelligence, we're looking for real intelligence. And how do we get to it? And so that's a key of what we have to achieve.
And I thought the entire panel today brought that up, is that this is a tool that we need to use, but it's us that needs to use it, and we need to bring human intelligence to bear on artificial intelligence. Smart city, what a terrific discussion.
You know, it's amazing because it also, I think, brings in the importance of what we started to hear about, going back to even some of the conversations from Nancy earlier this morning about the importance of understanding social determinants in delivering health. And so what we saw in the smart city was that it's more than just having a great healthcare system. It's about access to that system. It's about transportation. It's about the overall environment. It's about where are people getting their food and what are they eating. And so I think that when we look at smart cities, and there's a number of them here, in fact, Alex Drain, who interviewed with Callum last night, was on her way to Muskegon, Michigan, which is one of the cities that was enrolled in Esther Dyson's Way to Wellville, a competition to find cities that are willing to make commitments to improving the health of their citizens. And we saw some examples of those, the 6 cities that were highlighted by the panel, and I think we'll see more cities jumping into that as well.
And it fits again well with Dennis Robbins' theme of people, not patients, when the comment was made that a healthy city is not an integrated health system. Last session, virtual reality, powerful video about the potential of virtual reality and actually therapeutics.
It's going to make, I think, a world of difference in terms of also helping to extend care. We were chatting at lunch today about the ability of using virtual reality and augmented reality to help provide clinicians who are in areas where maybe there's no specialists, but yet you can put on glasses that will allow someone else to see what you're seeing and help guide you through a process. So augmented reality, virtual reality, I think is something that's nascent, but stands to be able to make a significant difference.
You know, I've seen the VR before, looking at the congenital heart disease and being able to give the patient, the family, the tour of the heart and to understand surgery, but really getting to see it as a therapeutic, for me, Lee, that was a step forward.
And what I hope that we're trying to do with regard to all of this is to understand that it does take the various disciplines that are here in this room. It's the healthcare practitioners, it's the innovators, the entrepreneurs, the venture capitalists, the governments that are involved in doing this, bringing it all together, as we saw with regard to some of the conversations in Smart City, to help advance some of these opportunities.
And that's perfect for the next segment, which is really the call for collaboration between healthcare and health tech leaders. And Tracy Wang from Duke had sent this tweet out this morning, really reminding us that there'll be an important event at AHA Scientific Sessions in November, bringing together tech leaders, academics, venture leaders, to try to have continue this conversation.
Yeah, we'll have a full day on the Monday, I think it's
Monday,
November the 13th, where we'll have a great opportunity to continue this dialogue and discussion, and hopefully you can join us there. And I think that, again, what Nancy was calling for was this notion of collaboration and working together. The AHA is a convener, as a catalyst for making change, but also you can see the great amount of investment that's being put to these efforts by the American Heart Association in bringing better solutions to all of us for care. And I also want to make sure that we don't miss the opportunity to congratulate the American Heart Association for joining the Center for the Fourth Industrial Revolution. I think I missed 2 and 3, but I'm hopeful to be here for the 4th. So,
I'm hopeful to be here for the 5th and the 6th. But next steps, how to collaborate with the AHA Center for Health Technology Innovation. You've set it up nicely. Nancy talked about this. Eric is the leader of the center, has been talking about this. Great opportunity for people in the room to stay connected and to get involved.
And those connections can start here, but please continue the dialogue after the sessions today. And we want to thank everyone who was involved in putting this together, and let's give them all a big round of applause.